All right, in the next part of the presentation, we'll have a Q&A session. And since this webinar is pre-recorded, questions have already been received, and he will answer them. And we'll respond to your questions via email if we cannot manage them today. All right, let's begin with the first question. But before the Q&A session, you want to mention something, right?
Yes, so I would like to say that I'm actually very happy to see that in the industry and in the online media, like for example in Springer, more and more articles show up that actually show the digital dentistry. And I'm going to share my screen now to show you that digital dentistry is more accurate now than impression techniques in closed tray and open tray. And I hope more and more studies would show up, and this would become the mainstream. We would only take digital impressions for such cases. Okay, let's start with the Q&A.
All right, question number 1. Is there a way I can view the occlusal surfaces of both arches and see where there are occlusal contacts and centric occlusion, the occlusion that was scanned?
Yes, of course. After we have taken the occlusion and then the scan bodies or any stage of the scans, we can go to the occlusion stage. And in the occlusion stage, as you can see on the lower right of the screen, there is an icon with a tooth. And if we press that icon, we have the occlusion analysis tool. And if we check the open bite here at the bottom of the screen, both arches are showed with the contacts. And so you can, of course, see the both arches and contacts after you finish your occlusion taking.
All right, let's go to the question number 2. Are you going to share some tips for scanning the freestanding scan body as well?
Well, from this question, I would say the user wants to know if we are going to address full arches. And yes, this is what I plan to do. The next webinar is going to attend full arch scanning with various tools and ways from around the world. And the last webinar that I'm planning to show is going to have my own way of taking impressions for implants, be them one implant to a full arch, that I hope is going to hugely improve precision in the whole of implant scanning. So let's see after these webinars if there are any other questions regarding these workflows. I'm also will be happy to answer them.
Right, I'll go to question number 3. Do I have to use the AI matching function all the time? Isn't it too much work?
So to answer this question, we can actually share some information regarding how this is done. So if you are not going to use the AI, the technician will get your impression with the scan bodies inside, and he's going to use external software to match the library to the scan body. So when this happens, the algorithm internal to that software will be used. And as you can see on the screens, there are studies that show that these algorithms are not repeatable. So they do precision, but because every time you do it, you get a little different answer from the software. These algorithms are not good for bars in implant bridges. So if you want to actually have a better result, a more precise result, my recommendation would be, yes, use the AI from Medit, because the guys here have implemented something beautiful that uses a completely different approach. And I think this is much more precise than letting your technician do it for you.
All right, thank you. And go to the next question. My understanding is that once I make green the area where the distinctive shape is on the reliability map, I can stop scanning even though there's an empty area on the back side of the scan body. Is that correct?
So let's think about the scan body. The scan body that has parts that are scannable, and these parts that are scannable are usually built of a flat surface, of a top plane, and of a cylinder. Of course, the AI can already match the library scan body to what you've scanned prior to having a full impression of that scan body. But if you help the AI, it will do a better job and it will better align the library scan body to your scan. So my recommendation would be, if you can, if you are able, try using the protocols that you're gonna see in these webinars and try getting full impressions of the scannable part of these parts that you have on the arch.
Okay, so go to the next question. Do I need to always remove the scan body while taking a bite?
Yes, so to answer this question, think about this. You have scan bodies on your working arch. First, most scan bodies are high enough to impinge on the occlusion and to not let the patient bite down on them. But if the scan bodies are low enough and you have done an impression of the working arch with scan bodies on them, you can take an occlusion like this. But normally in the op stage, we need to have the emergency profiling. So the scan bodies are no longer present. If you do an occlusion alignment and what you have on the arch doesn't match what you have in the occlusal scan, you're actually giving trouble to the software that is trying to align both arches together. So my recommendation would be, occlusion is not recorded with scan bodies. You can though record occlusion with the healing abutments, as I showed in the webinar. This is a better way with high healing abutment that are almost touching the occlusion, that you can do.
All right, go to question number 6. Sorry, I've just started using the Medit scanner and I don't know what scan body is. If I would like to scan for the implant case, should I get the scan body? And where can I buy it? From Medit?
So Sue can correct me here, but to my knowledge today, I don't think Medit is selling scan bodies. But to be able to buy a good scan body, you have to think that even if the scanned part is actually being compensated by AI or best fit matching ways, the connection part is very important, because if the connection is not milled correctly, the scan body is going to be misaligned from the start. So if you want a good scan body, you're going to buy it from your manufacturer or from a third-party manufacturer with industrial capabilities, so that the connection is perfectly milled and fits correctly in the implant. And I would personally avoid, from personal experiences, I would avoid scan bodies that are being milled or done in local labs or done by yourself, printed or milled by yourself in your clinic. So buy original parts and you're going to get good results. Avoid any parts that you do yourself.
And in addition, Medit only provides scanners, not the scan body. Yeah, unfortunately. Right, let's go to the last question. Is it okay not to scan the emergence profile and the scan body separately? Is that affect the accuracy of the finer crown? What is the difference between scanning them separately or at once like an abutment tooth?
So when you take the healing cap off, you're going to see your emergency profile. If you put the scan body in and scan everything together, part of the emergency profile is going to disappear in the scan. And also, until you are able to scan this emergency profile with the scan body, some good minutes will pass. And from my understanding, the healing profile, the gingiva will collapse pretty quickly, between a minute or two. And so you're not going to even get what is shown there, what the scanner sees is not going to be the correct emergency profile. If you do this, when your scan goes to the technician, he needs to get a crown with the correct emergency profile, and because he doesn't see anything there, he's just going to do assumptions as to how the gingiva is correctly profiled. You can overpress or underpress the gingiva doing this, and also you can have worse effects like impinging on the underlying bone. So if this still happens and you have sent such a scan, it would be interesting not to numb the patient when you go down with your crown, and if he feels pain, not much pain, but if he feels a little pain that goes away after you stop screwing, you've probably only compressed the gingiva. But if the pain persists after you tighten the screw, then you probably have pressed the bone and you're gonna have bone resorption. So please, if you are able to, always take impressions of the emergency profile.
Okay, right. I think we've covered every questions we got.